Imagine a child struggling to breathe every night, unknown to them and their family. For many children with Down syndrome, this is their reality. So, good morning. Today, we are here to unmask the silent struggles faced by Down syndrome children. Down syndrome is the most common genetic disorder associated with craniofacial abnormalities, and this is caused due to the additional copy of chromosome number 21. Obstructive sleep apnea is the disorder of breathing during sleep characterized by partial or complete obstruction of upper airway during sleep. Now, the question is, how common is obstructive sleep apnea in children with Down syndrome? The answer is about 50% of children with Down syndrome experience obstructive sleep apnea. And among those children, 50% of cases are always severe. Now, the reason to this is their unique facial anatomy, and these include hypoplastic midface, flattened nasal bridge, macroglossia, typical thicker neck, enlarged tonsils or adenoid, and hypotonia of muscles.
Symptoms of sleep apnea in children with Down syndrome include loud persistent snoring, frequent awakening, gasping or choking sounds, and restless sleep. During the day, they may display signs of fatigue, irritability, poor concentration, and sometimes learning or behavioral difficulties due to disrupted sleep. If untreated, sleep apnea can lead to serious complications. Oxygen level drop repeatedly during apneic episodes, which can strain the cardiovascular system and lead to high blood pressure and over time heart enlargement. Additionally, inadequate sleep can impair growth and development, and it may worsen cognitive and behavioral challenges affecting attention span, memory, and social skills.
The diagnosis of obstructive sleep apnea in Down syndrome patients relies on overnight polysomnography, which is the golden standard method. PSG monitors airflow, oxygen levels, and sleep patterns, essential due to their unique anatomical and physiological structures. In addition to PSG, other methods for diagnosing obstructive sleep apnea in Down syndrome patients include home sleep apnea testing, oximetry, questionnaires, and imaging studies like cephalometry or MRI.
Treatment is tailored to each child, often starting with an adenotonsillectomy to remove enlarged tonsils and adenoids, which are common in children with Down syndrome and often contribute to airway obstruction. Study shows that this procedure can significantly reduce symptoms in many cases. For children who continue to have symptoms after surgery or if surgery isn't recommended, positive airway pressure therapy is often the next step. CPAP or BiPAP therapy involves using a machine that delivers air through a mask to keep the airway open during sleep. This can be very effective, though adjustment to the mask may take time and often requires support from both family and medical teams. In addition to these treatments, weight management is critical. Obesity can worsen airway obstruction, so a balanced diet and physical activity are encouraged to support healthy weight. Oral appliances like mandibular advancement devices may be recommended for children with milder cases. These are custom fitted by a dentist to reposition the jaw or tongue, helping to keep the airway open. Regular monitoring and adjustments are essential, especially as the child grows. Ongoing follow ups and periodic sleep studies are vital to assess the effectiveness of treatment and adjust as needed. With a multidisciplinary approach, children with Down syndrome and sleep apnea can experience improved sleep quality, leading to better physical health, cognitive functioning, and overall quality of life. Thank you.